Guys, welcome back to Medical Coding with Blue. Today's episode is all about what kind of industry is medical coding and or health information. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so what kind of industry is this? What kind of industry is medical coding? What kind of industry is health information? And when I talk about health information, I'm talking about health information management, health information technology, our leaders, right, of our industry. What kind of industry is this? This industry is a huge exercise in adaptability. That is what we do. We adapt often and frequently because that's the way that this industry is. There has been many changes since even I started, and I started 16 years ago, and I've been doing this. I have seen the conversion from one diagnosis classification, which was ICD-9 when I started, to ICD-10. I watched and I was part of that transition. I was part of that change, and that happened in 2015 when those new codes came out, and we started implementing those codes into action for our daily work. Okay, ICD-10 has been around for a long time, but October of 2015 was the first time that we all started to apply those codes and use those codes in our daily work. Okay, so that's just one of those things. But this industry is all about change. It's all about being ready and adaptable because changes happen quite frequently. You know, the laws always update. Health insurance changes on the regular and sometimes often without warning. And we are affected as medical coders by this because sometimes an insurance company will accept a certain code and other times they will not. Sometimes they want a modifier and sometimes they do not. So we always have to be at the ready. We always have to be at the ready for change. And it doesn't mean that the industry is going anywhere. It just means that we have to always be ready. Like I said, seeing that change from ICD-9 to ICD-10, when we were in the pandemic, of course, seeing an unprecedented action of a new code coming out in mid-year. That does not happen, but it happened, and we all saw it, and we were ready for it. And we were part of the very frequent changes where we had to code it a certain way, and then we had to not code it this way, and then code it this other way, and this insurance wanted this. So I say all this to say that if you're going to get into this industry, it's not going to get boring. That's for sure. Now, the coding that you may do, depending on where you're coding at, that may get redundant. It may be the same thing. It may be just a lot of tediousness because it's the same thing over and over again. But if you allow yourself to be open to change, and it's very difficult. You know, we get so used to having things a certain way, we get used to it, we get confident in that, and all of a sudden we have to switch. We have to make this change. And so if you are willing to make those changes regularly, and if you are always ready to say, okay, I'm going to try something new, then this is a great career field for you, because this career field, again, is always going to be different. It's always going to change. It's like stepping into a stream of, like a river stream, right? It's never the same once you step in it, because now the current changes and the water flow changes and everything, and even the level of the water changes. So it's the same thing with this career field. And there's a lot of things that you can do with health information and with a degree in health information, or even with the medical coding certification. And those things require a lot of knowledge. That's what we are. Above all else is smart and hardworking, and that's what we do. And a lot of people think that, well, it's a desk job, so it's not that hard. Trust me, it is hard, and you can feel just as worn out working all day at a desk job as you would if you were working at a bar, or if you were, working, outside in construction. It is that same level of fatigue that you can get. But of course, there's always ways around that. There's always things that you can do to mitigate that fatigue. But again, it's all part of the work. It's all part of the job. And we have seen the adoption of medical records. Okay, that was already in the works when I was coming in, but in the early 2000s, we started to see that. In the mid 2000s, we started to get those laws that were referring to those electronic health records, and so that also we had to be prepared for. And when we switched over to ICD-10, there was a lot of people that thought that American coders weren't ever going to be able to catch on to it because it was a lot. There were so many more codes. We went from a standard code set to an even more expanded code set. And this code set expands every single year, And then in about another 20 years or so, we have ICD-11 on the horizon. A lot of people talk about ICD-11 now. It's not really pertinent to what's going on now because, again, that is far off into the future. There's a lot of things that go into having a code set approved. There's a lot of government policy that also has to pass in order for a new code set to be implemented in the United States. So, and for those people that thought, oh, American coders weren't going to be able to get it, we rose to the challenge and we got it. We had a very seamless transition to ICD-10 because of the professionals that we are, right? Always ready for change. And so that's a testament to us as professionals, as health information professionals, medical coders, because we can do anything that we set our minds to. For some people, they like to do things the same way all the time, and that's just the way that they're comfortable. But for those that want to have that stretch of professionalism and that stretch of personal development, this is a great career field for that. Because you can always start off as a medical coder, and then if you decide that you want to get into clinical documentation integrity, or you want to get into provider education, or maybe even educating other medical coders, there's always that option. And so it's not just, you're not just limited to just doing one thing, right? And it's the same thing for our leaders. You have the opportunities when you have a degree. Okay, you can head up whole departments, you can teach, you can also do those things. And so there's a lot of opportunity as long as you're willing to invest and be adaptable to change. Recently, our CEO for the American Health Information Management Association stepped down. Now, he stepped down for personal reasons, and it's okay. The industry and the organization for AHIMA is going to be okay. We have gone through a lot of changes with management, and we've all been fine, and we're going to continue to be fine. The organization's going to be fine because of our willingness to accept the change. That's just one of the things that's part of being in this field, is that when you are in it and you understand it, it's just our way of moving forward, and we are going to be able to move forward. And we are going to be able to embrace that change and be able to look at all the things that are happening in our areas and help our providers or help each other and to better understand this, because this is a lot. Medical coding, health information is a lot to understand. It's a lot to understand about the coding. It's a lot to understand about the rules. There's a lot to understand about reimbursement. There's a lot to understand about the laws. And we all have to work together to do that, to have that knowledge, because we learn from each other. As much as this industry is very autonomous, right? We still need each other for that feedback. We still need each other for that growth. When ICD-10 we were switching over to ICD-10, we had a lot of subject matter experts on ICD-10 come and talk to us. And one of the people that came and talked to us at our facility was a physician champion from another facility. And he was explaining a lot of things about the codes, things that I hadn't even thought of when I was looking at the codes. And it wasn't until he explained these things that the light bulb turned on. Now, I say this to say that when we have each other, there's nothing that we can't do, right? And so taking that knowledge from this physician champion, I was able to put that into my own personal arsenal of knowledge, because I was going through two prep programs for ICD-10, the conversion. I was going through one at work and I was going through one personally. And whatever I didn't catch from the first one at my work, the program that I was going through on my own filled in those gaps. And so that helped me to be more well-rounded. And then, of course, taking that knowledge from that physician champion made it even better. Okay, so that's just one of the things that you have to know. It's not a single person type deal. And even though we build on our own knowledge, we can all learn from each other. And that's just one of those things. That's what we do. But this is a great career field. It's always going to continue to grow because this is one of those things that while we have technology and while there's technology out there, of course, the electronic health record came up, early 2000s. And it's gotten more sophisticated with time. Now there's, computer assisted coding and things, but it's still a computerized program. It still does not have the ability to critical think. And for those that think that a doctor can write in the same way every single time for every single patient, every person is unique. And because of that, there's always going to be a change in how they speak and how they write and how they document about their patient. That's why we have a job, because it's not always going to be that everything is so dependent on technology. They still need the critical thinkers. And that's what we do. We got to critical think. And because of that, it's always going to be where we are going to use technology to help us, but it will not replace us. And that's what a lot of people think. And these people that think this are often people who are not in our industry and who don't know. And there's a lot of misconception about our industry from a lot of people, because a lot of people don't really understand and they put out their assumptions. And then when people are doing their research and they don't verify those assumptions, that's how misinformation gets spread. Okay? And so we don't want that, so that's why I'm making this video today, to explain what kind of field this is. It's a field about growth, personal and professional. It's a field about adaptability, because there's always going to be change. If not the change in the electronic health record, it's going to be a change in the laws. It's going to be a change in how things are billed and things like that. There's a lot of things to that, okay? But again, we will use technology to help us, but it will not replace us. It may make things faster, which is, look at the encoder. The encoder, if you don't know, I want to sneeze, is an electronic code book, okay? And you can put in a few words and it'll start to lead you on a path to getting the exact code that you need. It'll ask you questions and then it'll give you the code. Sometimes it's not always right, especially if you're brand new and you don't really know how to use the encoder, or you don't know the answers to the questions. And if you select the wrong answers, it could lead to you getting the wrong code. So that's why I always say, depending on your books is always going to be best. But going back to using technology to help us, that's what it's going to do. Again, it can't replace us. And if you hear that from somebody, question what it is that they're saying. Why are they saying that? Because if they don't know and they're not in our industry, then why are they talking? What agenda do they have? And that's something that you got to think about. You can't always believe everything you hear. And this field requires us to know what doctors know while never having gone to medical school. And that's for across the board. That's the medical coders, that's the health information technicians, that's the health information management folks. That's all of us. We have to know this stuff. And it's a tall order. It is a very tall order, but it's not impossible to learn. It's not impossible to get to that level of knowledge. It's going to take a long time. I've been in it 16 years and I'm still learning, but I still made efforts to help myself to be successful in learning and understanding what my providers are saying, so that they don't have to change how they speak to me, that they can speak to me how they would regularly speak if they're trying to explain things to a colleague. I struggle to keep up sometimes, but a lot of times I'm able to be right there and I understand. Some things I have to take note of and look up later, but that's okay, because again, it's me growing as a professional. And this is the exciting thing. That's the most exciting thing about this, is that when I think back to where I started 16 years ago versus now, it's just an incredible journey. It is an incredible thing to have all of this knowledge and to be able to speak and interact with some of the most intelligent people I will ever meet in my whole life. And having those conversations means a lot. And getting that knowledge and being able to pick their brain and listen to them and how they speak and how they think and what makes them tick as providers, that's incredible. You know, that's one of those things that you don't always get that. That's not always an audience that you have. Most of us, when we are interacting with doctors, we're patients, right? We're not their teammate. And that's what medical coders, health information technology, and health information managers are. We are their teammates. We don't just blindly follow what they say because they need us. They need us because we know the coding side. This is a whole side that they have no idea about. That's the one thing that I wish that doctors would get in medical school, on top of everything else that they have, is at least a semester in medical coding and documentation. Because if they got the documentation right out of the gate, there would be so much less waste in the industry, right? Because there wouldn't be these wasted encounters because the provider didn't document everything like they're supposed to. Now that documentation has to be queried to be more clear about what happened in the visit, and then that's just going to take longer for the claim to get paid. And then, of course, there's going to be penalties. Again, waste. So that's just one of those things that I wish. But again, the industry is going to become more sophisticated. But I always tell people that we can keep up with the sophistication as long as we stay educated. You know, and again, some people think that, oh, well, no, it's going to be where we can always depend on the electronic health record and it'll code it for us. No, not some of the things that I've seen. When a doctor is discussing a season and documents it as fall, and then the electronic health record is trying to look for an injury, that's wrong, right? And among the myriad of other things that I've seen. But that's just one of the things. And it really, again, it all depends on how the doctor is speaking. But again, we're always going to use technology to support us, to support the mission, to be able to be more efficient, to be able to catch things that maybe we didn't know. But again, that's why we have to have that critical thinking, you know. But this is a great career field. It's a career, it's not a job. And there's a lot of jobs out there. And this is not it. This is not a job. For me, it's not a job. There are some people that it is a job to them because this is more than what they expected it to be. They don't like it, or maybe they're not working in the best environment that they could be working in. Not every environment is suitable for every coder. There are some coders that need more challenge. There's some coders that need more guidance. There's some coders that need more autonomy because they're able to figure things out on their own better. And so it really all depends. But we don't always know this, right? We don't always know this. And communicating is really important to be able to figure that out and to be able to get all of that sorted out so that we can be more successful in this career field, okay? But like I said, this is not a job. This is a career. I figured that out in 2014. So a year before we transitioned over to ICD-10, I figured that out. We were going through the education of the new ICD-10, and again, I was studying at work and at home, and going through all of that, I started to get it. And it's like that fire gets ignited in you, and then you think, oh my gosh, I'm so excited. I'm so excited to get to work. I'm so excited to learn this stuff. And then when ICD-10 kicked in that following year, it was even more exciting because then I could see it in the documentation. I could see it in the codes that were being selected, and I could learn more things, and I could spend time with my providers because we went from being housed away from our providers to being embedded in the clinic. And that is the best. If you can be next to your providers, and I know there's all these people that want to work remotely, and I want to work remotely. You have no idea what you're missing out on if you are away from your providers all the time. If you get to be around them and you get to see and listen to them and know how they think and work with them, there's so much that can be accomplished. I have personally seen this when we were doing the transition over and we were developing those relationships with those providers, and I saw how important that was and how they benefited and how they still benefit to this day because they know about coding. They know about coding because I was there to be able to help them and to teach them. And that's the best feeling in the world when I still get calls to this day of providers that I've worked with before that says, thank you, Bleu, for your help. And I get it, you know, they still get it, right? So that's the thing. If you're considering this career field, just know that it is all about adaptability. Just know that even though we may have a formidable challenge in front of us, that as professionals, we always rise to that challenge and that we need each other. And no matter how much you want to work by yourself, it is a team effort. You may not be working with another coder, but you'll be working with your providers. And they may bluster, they may get upset, and they may not want your direction because they're not used to that. That's one thing that I always hope that coders catch from my channel, is that it's okay to speak to your providers, even though sometimes they bluster in the beginning and they may not want to listen to you and how dare you and who are you. It doesn't have to be that way. It doesn't have to be that way at all. And it can get better, you know, and it's going to take you to grow. It's going to take you to be the one to initiate that communication sometimes, because they won't. Providers won't. And I hope y'all understand that it's a good thing to be in control of that and to be the one to be able to initiate conversation with your providers. And you don't have to apologize. Oh, I'm so sorry to interrupt you. I'm so sorry. Don't apologize. What you're doing for them is you're being their teammate. That's what you're supposed to do. It doesn't require an apology. Okay? And just know that. Just know that it doesn't require an apology at all. And being direct is one of the best things that you can be, because no one has time. Everybody's got to get to what they've got to get to. The smaller you can keep your explanations, the more direct you can get that, the better, because that's what they need. They don't need a long drawn out conversation. They'll come and talk to you when they can have time. And I've had that before too, where providers will just literally come in and sit and they'll just talk. They'll talk and I'll set up my little bear trap. It's called a bear trap, but it's like a candy basket. And they come in, they sit there and they just decompress. And sometimes that's what they need. And you are that teammate for them. Okay. Again, if you work at home, it's a little bit harder, but it's not impossible to build relationships, especially if you can get into the office every once in a while. Just to let them see you, let them see your face, so that way you can build those connections. Because again, when you're connecting with them on Messenger or anything like that, or by email, they need to know who they're speaking to. You know, and this is one of those things. Again, adaptable. Being adaptable is one of those key characteristics of health information professionals. I'm just saying. So, with that said, if you are considering this career field and you want to know more about it, I hope that you will check out my other videos. There's lots of videos that answer the most basic questions on where to start, how to get started, and what means what. Inpatient. What does inpatient mean? What does profi mean? What does outpatient coder mean? And there's a lot to this field, but it takes a lot of, your own research and just being able to do that. That's one of the things that's going to set you up for success, because that's one of the things that you're going to need the most. That's just my advice anyway. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.